Hi, I'm Amanda Asbury. I'm a pediatrician and have practiced at Community Physician Network since 2025. I've really always thought about becoming a physician. I remember as a little girl always playing doctor with my dolls. My family gave me so many doctor's kits as a little girl. And then going into high school, I was always drawn to the sciences. Also started developing a desire to serve and help other people. And that kind of naturally led me to medicine. I chose pediatrics because I've always been drawn to working with children. In high school, I worked at a climbing wall at the YMCA. In college, I did a lot of reading programs with kids as a volunteer opportunity. And then I went to medical school, and working with children was just the most fun and rewarding. When I think about what's important to me when I'm treating patients, I think of two different things. One, what does the research say is the best for healthy outcomes? But two, what's really important to each family? I try to listen and really hear what's important and what's going on. And then together I want to talk about, what does the evidence say? What does the research say is best? And then combine that with what's important to each family to create a really special care plan for each person. Our pediatric clinic will have a full spectrum of pediatric care, providing well services from newborn into adolescence up to, kind of that beginning of college age, looking at development and growth, providing immunizations, and then also providing chronic disease management. I do have additional training providing early diagnosis for autism spectrum disorders. So identifying some of those children with developmental differences and helping those families access needed services is something that's really important to my practice. Outside of work, I do have my husband and my two wonderful children. I've really enjoyed, raising them, and especially it's impacted my practice in the way that I'm able to empathize with families and what they're going through and kind of talk through some of the different things that I've maybe tried when they're going through a behavioral struggle or something like that. I'm Amanda Asbury. I'm a pediatrician and have practiced at Community Physician Network since 2025.